Hello, good afternoon. This is Dr. Velma Scantlebury, and I am going live with the Citizens Educational Center, and I'm hopefully will be joined by Joanne Smith, and I'm hoping she will be on in a minute or so. So those of you who normally join me, this is Dr. Velma Scantlebury, and I am the medical consultant here for Dialysis Patient Citizens Educational Center. So trying to get the glare out of my glasses so that we can get started and hopefully still be able to see what I'm doing. So we shall start soon as I can hopefully be able to get Joanne Smith onto the call, as she is an expert, and we're also hopefully will have Nancy Scott also. So I'm hoping that they will be on here. Thank you, Ann Williams, for joining. We are waiting for our guests to appear, and I hope wherever you are, you're having a wonderful day and that your Thanksgiving was joyful and that you had a chance to spend some time, some downtime doing the kind of things that hopefully, whether it was family, whether it's being outside, whether it's was eating some good family cooked food. We hope that you had an enjoyable time. So, as I said, I'm Dr. Velma Scantlebury, and I am waiting for my colleagues, Joanne Smith and Nancy Scott, to join me on this platform today. And this is Dialysis Patient Citizens Educational platform. Ask the Doctor. So since you're here, if you have any questions to ask me, please go ahead and put them in the chat. So I don't have any comments, and I'm waiting to see where is. Oh, I'm glad you enjoyed your Thanksgiving. Are you a transplant patient or are you on dialysis? I know if if you're on dialysis, there's so many limitations to what you can eat and what you can't eat. And for some patients, even after transplant, they can have issues still with blood pressure. So they have to watch the salt intake, and you have to watch your potassium depending on uh, how far out you are from your transplant early on. There's many more issues with potassium in the early months after transplant, but much less so as you go on. But many patients still have to be careful with that, even with holidays and the kind of foods that serve that can be often lead to, whether it's high phosphorus. Generally for many transplant patients, they're battling low phosphorus once the kidney starts to work very well. And the biggest issues are generally potassium. And I've seen many patients go from very high phosphorus, so now the kidney is working well, and now the phosphorus is too low, and they're battling trying to get enough phosphorus in. And it seems like quite a reverse. So thank you, Richard, for joining. And I see River Chris is also on. Thank you so much. I'm Dr. Scantlebury. I'm the medical consultant for Dialysis Patient Citizens Educational Center. And I was supposed to be having a conversation with Joanne Smith, and I hope I'm on the right link because obviously she's not here yet. So I'm hoping that she'll be able to join and talk to you about ask some questions for her as a transplant care specialist. She advises patients on the options for care, whether it's hemodialysis, whether it's peritoneal dialysis, whether it's home dialysis, because they're all very different, and not every patient gets that information that they're able to digest appropriately, not at the right time. Because if you are diagnosed acutely and you are in stage 5, or you're diagnosed via a hospitalization that now says you are in acute renal failure of stage 5 and you need to be dialyzed, and that dialysis is urgent. And that will allow you not to be able to make a choice until you are already established on hemo. Let me help share. Perhaps someone will benefit from this in my timeline. Thank you so much. And so it's important to know if you are diagnosed with kidney disease in stage 3 or 4, then you're educated, you have opportunities to be educated about what your options are. At least you should be educated about what your options are in terms of both getting that information about hemodialysis as well as peritoneal dialysis, understanding what's required to do home dialysis, as well as peritoneal dialysis, the benefits and disadvantages of whether or not you're traveling. If you like to travel, knowing that with in-center dialysis, when you go from one location to another, you're going to have to be able to set up that dialysis if you're traveling to visit family or friends to make sure that there's a center that can dialyze you. So those things are important to take on. And for many patients in acute diagnosis of a chronic renal failure needing dialysis, it's a lot to swallow, especially when they didn't see this diagnosis or didn't know about this diagnosis, and this is now suddenly, now I have to be connected to this machine in order to live, and what the options are. So I don't know how many of you knew about your kidney failure before, a significant time before you ended up on dialysis or before you got a transplant. Some people are fortunate enough to have that window where they are able to digest this information, find a living donor, or get on the list uh, with without being on dialysis, but given the information that living donation is an option for them if they can seek out a living donor, and if they have anyone possible, but if not, that they can get on the deceased transplant list before they start dialysis. And that is so important. So many people that I meet feel, okay, I need to be on dialysis before I can start thinking about transplantation, but that is not that's not necessarily so. So it is important to understand that there are options out there, and the sooner or the more you understand about your disease and um how it progresses, knowing that it can often be asymptomatic. I think I'm losing folks here. Am I losing my audience? People are coming and going. Let me change my location to see whether I can get a better Wi-Fi connection here. Let's see. Is everyone able to hear decently? Um, Thank you, Arlene and Bobby, for watching, for being here. And Sandra, I'm missing my partner, Nancy Scott. She usually is firing questions to me. So I'm trying to find a location where I can get a better Wi-Fi connection. So I hope you are able to hear me well, as my connection does not seem to be really um, up to par. But Bobby, I see you're watching, and Arlene, as well as Adwo. I hope I pronounced that correctly. So good afternoon, everyone. I'm Dr. Velma Scantlebury, dialysis consultant, medical consultant for Dialysis Patient Citizens Educational Center. And I am here. This is Facebook Live, here to answer your questions. So if anyone has any questions, go ahead and put them in the chat. I am hoping that my co-partner would come on, and I am supposed to be having a conversation with Joanne Smith, and I'm hoping she will be here. I don't see her in the waiting room. But anyway, if you have any questions, please put them in the chat. I hope you guys all had a wonderful Thanksgiving, uh, and that you didn't have to have any extra dialysis because of uh, your diet or excess fluid. I know it's hard during the holidays to be able to keep that fluid off. For many people, the Thursday, if they were dialyzed on Tuesday, Thursday, Saturday, they might have switched over to a different day and maybe extra dialysis on Friday and Saturday to compensate for that day. And so we want to be able to realize that we now have the same issue coming up in December with Christmas and New Year's. Some of you may be off track with your dialysis. Be careful with your fluid volume. Remember that is generally the biggest significant contributor to heart disease while on dialysis. And that is so very important. We want to be able to understand that if you're not making urine, then it's not easy, then the excess fluid that you take on cannot come out via your urine. You have, unless you sweat out all that extra fluid. And that means you have to work really hard in exercising to burn off some of that fluid. So what you go in, what you take in is going to be very important on that weight gain to be able to uh, really keep your heart from being stressed out. So maintaining adequate fluid levels. If you have an underlying heart disease, remember that that is can lead to congestive heart failure and a need to be admitted to then take off that extra fluid, get you and get your heart optimized. So do not let the holidays put you backwards. The goal is for you to stay in good shape, maintain your heart health. Because if you are waiting for a transplant or you're on a transplant list, you know that's important. If I have a patient coming up and they've just been admitted for congestive heart failure, I will probably be a little reluctant because I know that immediately after transplant, I'm going to flood you with fluid, not necessarily flood, but you're going to have a lot of fluid between anesthesia, IV fluids, antibiotics, anti-rejection medications. You're not allowed to drink, so you're given a slow drip, and you're laying in bed. So all those things would contribute to about a 5 to 8 kilogram weight, and we want to sometimes more, depending on if your kidney starts to work right away, and you're making urine, then you can get some of the volume off. But if you have a sleepy kidney and it's not working well in those first few days, then we're going to hold off on dialysis to make sure that that kidney actually starts to open up, and not put dialysis on, and complicate it by providing dialysis for the kidney, which may slow it down from that initial working. So we want to push it to the limit, but we also need to be cognizant of what your heart is able to do. And that becomes critical. So as we come into the holidays, remember that while it may not be uh, all the drinks that are on the table, cocktails, whether it's the gravy, whether it's any component of fluid has to be taken into consideration, especially if you're missing a dialysis day. During the week, on a Thursday for the holiday, most of you will be dialyzed Friday or Saturday, unless you're out of town and therefore have to find another dialysis center. But the goal is not to put yourself at risk. For those who are transplant patients, for most patients, it's a potassium issue. If your kidney is working well, depending on where your kidney, if you're immediately post-op, they're still watching your fluid intake. And you may have to be careful. As you know, many of the anti-rejection medicines can make your potassium slightly higher, such as the Prograf. Oftentimes, for many patients, immediately afterwards, they may be uh, less likely now, but on steroids, and that may increase your appetite. And so you have this urge to want to eat a little bit more. And now you're also have the ability to eat things that you didn't eat before. And so you may go overboard with some of the things that you're allowed to eat. And so we want to be cautious in that those for a few weeks after transplant. So that's important. Hello, everyone who's here. I thank you for hanging on. I'm not sure, some of you are going in and out or having to drop off and come back, but thank you for um, returning to join us on this Facebook Live. Dialysis Patient Citizens Educational Center and Ask the Doctor session. So I am talking, but I don't see any questions. So let me know if you have any questions and any concerns regarding not just you, but your loved ones. If you've just been transplanted, uh, if you've had biopsies, some places do automatic biopsies after transplant. One, because as you know, it's kidney failure is not generally symptomatic until it gets to the end. So as with transplant, your kidney can appear to be working fine, but you may have rejection. So for some programs, there's a biopsy at 3 months to make sure there's no subclinical rejection that's sneaking into play and that your medication, your anti-rejection medicine is appropriate. For others, it may just be an appearance of protein in your urine can also signal that something is occurring that wasn't there before, as long as you didn't have protein in your urine. And you will notice that if you're transplanted, you're constantly checking. Part of your routine labs include a urinalysis to assess what's going on with your urine. Urine infections can also be asymptomatic. So we check to make sure that there's no such thing going on. And so that becomes important. Um, and so it's, Dorothy said, I'm a transplant patient. I have really bad cramps in my legs. What can I do? Again, you want to make sure you talk to your healthcare provider about that, making sure that your electrolytes are normal in terms of your magnesium, your potassium, some patients, and that you're not dehydrated. Some patients are not used to drinking a lot of fluid, and if the kidneys are making a lot of liquid, oftentimes it's hard to keep up. But I also find too is that two things that tend to be on the low side constantly, one more than other post-transplant, is magnesium and potassium. And so magnesium for many patients, even after years, may still need to be supplemented. And so just talk to your doctor about it, making sure that you get your labs checked and that you also check your fluid level and that you're not dehydrated. I'm not sure where you live, whether it's hot, whether you're not drinking enough. That may be one of the issues. So thank you, Michael, for your suggestion about fluid. But bear in mind also that you want to make sure that you don't have underlying heart disease, because if your doctor have you on a diuretic water pill, it means that you may have too much fluid on board, or one, you're trying to control your blood pressure by keeping your fluids low. So it may not necessarily apply to everyone in terms of drinking a lot of fluid. So make sure your heart status can handle the fluid, and that your legs aren't swollen or you're not on a diuretic because of underlying, heart disease or high blood pressure. So keep those things in mind. But generally, you want to make sure you get your labs checked and that you're there. I mean, usually the routine labs contain potassium, but they have to add phosphorus and magnesium, which is part of the transplant uh, renal panel. So thank you very much for that question. Again, I am Dr. Velma Scantlebury. I am the medical director for Dialysis Patient Citizens Educational Center. I thank you all for being here. Barbara, thank you for coming on. Let me know if you have any questions. We've been talking about the issues of holidays and keeping your fluid under balance if you're on dialysis, making sure you don't jeopardize your heart function, because one of the things, as you understand, that heart disease is going to be the leading cause of death for patients on dialysis as well as post-transplant. And it's also one of the things that we as transplant surgeons want to make sure that your heart is able to tolerate that transplant process. But most importantly, not every kidney will work right away. And during that time, when you have that sleepy kidney, the goal is not to dialyze you, but push you to the limit to see if the extra fluid on board will cause that kidney to wake up and make urine. If your potassium is high and it's really out of whack, then you will be dialyzed to bring down your potassium, but not necessarily to make urine. If you're making urine, then we can use other modalities to help bring down your potassium, such as Lasix as a water pill will help you urinate more from that perspective. So it is important to not end up in heart failure immediately after transplant. So that's the goal, and not jeopardizing your transplant by overindulging with fluid and lowering your ejection fraction, because that's constantly one of the things we look at as you're even after transplant in maintaining good heart health in terms of your diet. You can't go overboard with your cholesterol. You're not going overboard with your potassium. You're not going overboard with your fluid. And so the goal is to be able to say, I want you, now that I've invested this kidney into you to get you off of dialysis, but also make sure you live a long time with that kidney. It doesn't benefit the transplant center to have you fail and not do well with that kidney when it could have lasted better in someone else. So we want to be able to think of it as a gift. Remember, it's coming from someone who donated that kidney, even in the midst of grief and loss of loved one, but saw the benefit of organ donation and said, I want my loved one's organs to be donated to help someone in need. And that truly is a gift. It's a gift from that family. And it's important to treat that gift with care, knowing that you have been blessed with that opportunity to receive a transplant because of that family thinking about helping others, even though they're facing a loss. So when you think of it from that standpoint, especially one of the things that we saw is that uh, living donation from the same household, wife to husband, husband to wife, mother to child, and do much better longevity because they're in the same household. So you see in the person who donated to you, there's a sense of responsibility, and I need to do better because they put their life on the line and underwent an operation to give me a living donor, to give me a kidney that didn't have to. They could have died on the table, but they made that sacrifice. So when you think about the sacrifice that was made to allow for organ donation to occur, we really have to say thank you to all the living donors or all the families who agreed to live in donation so that that so many thousands of people can come off dialysis every year and live a better life and have better longevity, or at least be able to do many more things that they weren't able to do before transplant. And so, and I say that in just because one of my patients said, well, I thought I was going to be able to play golf now that I am transplanted, but I still can't play golf. And her husband said, well, you didn't play golf before, so how do you expect to be able to play golf afterwards? So within reasonable expectations, the goal is to be able to get you back to work or get you back to a life that you're able to live. So thank you all for being here. We got about 5 minutes left. This is Dr. Scantlebury, medical consultant for Dialysis Patient Citizens Educational Center. And I'm so glad all of you are here with me today. I was supposed to be having a chat with Joanne Smith, but hopefully we'll be able to do that on another occasion. So we hope that if you have any questions, I know many of you are from our board members who are on and are watching. If you're a patient and you have had or recently treated for rejection and overcome that, let me know how it went, whether you're still on rejection medicine. If you're transplanted and haven't had any rejection, that's a good thing, because then the goal is for the medicines to be able to prevent that rejection and for you to have longevity. So knowing that sometimes when we get transplants, we're compatible by blood type, but we're not always matching every single gene because it's not necessary, because of the great medicine that we have that prevents rejection. And so that's the key. We used to say, okay, I don't want my sister can't donate because she's not a match. The only thing that's really compatible above board is blood type. I want to know that the blood type is compatible, but most spouse to spouse don't share anything in common, but they still do well. And so that compatibility is just making sure that the donor and the recipient doesn't share any antibodies, which is those attack and kill antibodies that would attack and kill the kidney. So we match by blood type. If you're A, you can receive from an A, and if you're O, you can receive. If you're O, you can also give to an A. So O is universal donor, but O, because they have both antibodies, they cannot receive from A or B, sometimes from A, but they're universal donor, but they can only receive from a blood type O. So when we have donors who are O and they're donating, then that's an opportunity to put them in a chain because there's other people who may have antibodies. If I want to give to my child and we're compatible by blood type, but somehow there's an antibody barrier that will cause my child to reject my kidneys, then perhaps I may want to give to someone else, and that someone can give to my child who is not sharing antibodies with that person. So when you think, for those of you who are considering living donation, even or have thought about it but felt that there are people who are not compatible, let the transplant center decide that compatibility, because that's why we do the cross match. And it's only compatibility by blood type. And if you're not compatible by blood type, there's the paired donor exchange that that your center may be participating in. And so everyone is put in a computer, and as long as you have a loved one, a friend, or someone who is willing to give you a kidney, then you both can go in the pair exchange system, and someone will receive a kidney. You may receive a kidney from someone else while your donor gives to someone else. So you think of the fact that it's not necessarily a blood type A have to give to blood type A, or blood type B have to give to blood type B. It is not that kind of compatibility. While it's good to be able to do that, the goal is to be able to make sure that you can accept that kidney. And if you're O, generally, if you know that the blood bank wants your blood, and you're able to donate to anyone. So I hope that's a little bit of education there on that. And it's also realizing that the goal now is, because there's so many people on dialysis and so many people waiting for transplant, that we have to consider more about who is out there who will be willing to give you a kidney. Is there an opportunity to get you off of dialysis, and knowing that that kidney donated to you is your kidney? You're not competing with all the thousands of people in your region, because that person wants to give just to you. And once you are donated, once you have received that kidney, there's one less persons for them to worry about, and it allows for other people to also get transplanted, because we the longer we know that time on dialysis, the longer you spend on dialysis, the more difficulty you have post for longevity of your kidney, because your body has suffered from all the issues of dialysis long term. So I really, without many questions, I've continued talking here, and I didn't get a chance to, somehow Joanne wasn't able to get on, Joanne Smith, but I hope that she'll be able to get on at a different time. And I thank you all for watching. I thank you all for being here. And I will see you again in the new year. So enjoy your holiday coming up for Christmas and New Year's, and stay healthy. Make sure that you stay protected in cases any COVID or flu is around. Wear your mask if you're at family gatherings. Remember to wash your hands, and be thankful, be grateful. God bless.